We are going to unload our expected client. It's a summer sore in the face. She found us on Facebook after she saw our video talking about summer sore prevention, how to treat it. So when she saw what was going on with her horse, mom got really concerned and contacted us through Facebook, and we told her, bring her in, we're gonna treat her, we're gonna get her well. So she just got here. I'm really excited about this case. So let's see what we got. Okay. How many more eggs are in there? There's probably a lot. So I gave this baby a little bit of sedation so that we're able to examine her wounds a little bit more closer. As you can see, this one here, it's a non-healing wound that has been there for around 3 weeks. So we really highly suspect this is summer sore. Flies just laid there and laid some eggs. The skin can start trying to do its thing and trying to create fresh tissue, but having those eggs in there and having some necrotic tissue in there, dead tissue, then it will never heal. It just continues to get bigger. It kind of dries up, but then all of a sudden it opens back up. To be able to treat this type of wound, we have to, as I mentioned, we're gonna sedate her, we're gonna debride it, we're gonna verify if there's some eggs in there, and we're gonna remove any tissue that looks infected, necrotic, eggs, everything that we can remove from in there. We're just gonna do that. We're gonna make it as clean as possible. We're gonna make fresh edges, fresh tissue, so that it can heal properly. I'm gonna start debriding the tissue to verify if there's any eggs in there, and also, remove this tissue that dried up and it looks kind of like dead tissue, so it creates new tissue and it can heal better. There isn't much sensation, there's more sensation around it, but I still like to block it around it just in case to start the healing process. Crunchy basically is what it's telling us is that could be two things. Could be the eggs, or could be just the tissue that is on the outside that is very dry. But then once I start getting in there and find some crunchiness in there, that's definitely indication of eggs. I just removed this piece of summer sore egg from this hole right here. So I'm gonna continue debriding and see how many more eggs are in there, and there's probably a lot. So I just cut this piece of the dead tissue that is there, and look at this huge egg under.
Too bright?
I sedated her and debrided that wound. Now you can see that she has fresh tissue. After I removed all that dead tissue that was in there, I saw under the tissue a lot of eggs. The biggest eggs I have seen from summer sore. So now we're gonna treat her with anti-inflammatories. We have a summer sore mix that has ivermectin on it. We are also going to deworm her again, give her some antibiotics because she does have a wound here that is a little bit affected, something totally unrelated to the summer sore. We have a stall that is AC and it's controlled from flies. If there's no more eggs in there, this wound should be looking beautiful in around a week. 5 to 7 days, you'll see the difference. You'll see it smaller, the skin starting to close. If the wound doesn't start to heal properly, then that means that we have to go in there again and debride, and it can happen. And as severe as this one is, there is a high possibility that we have to go back in there. And so we're gonna continue doing some wound management on her. After this debridement, everything should start healing properly because we removed everything that was dead in there and that was causing the wound not to heal properly. So now we're just gonna laser her, give her some hyperbaric chamber, give her some medications, and continue monitoring that wound.